Headache means pain in head. It is the most common form of pain. Headache is a symptom only and not a disease. Headaches are a very common condition that most people will experience many times during their lives. Headache can be throbbing, constant, sharp or dull. Pain severity is defined as mild, 1 to 3 doesn't interfere with normal activities, abdomen soft and not tender to touch. Moderate, 4 to 7 interferes with normal activities or awakens from sleep, tender to touch. Severe, 8 to 10 excruciating pain, doubled over, unable to do any normal activities. Pains are based on how quickly your pain starts and how long it lasts. Acute pain starts over a few hours or days and may come with other symptoms. Chronic pain lasts longer, from weeks to months or more, and may come and go. Progressive pain gets worse over time and often comes with other symptoms. What are the types of headaches? There are more than 150 types of headache. They fall into two main categories: primary and secondary headaches. Primary headaches. Primary headaches are those that aren't due to another medical condition. The category includes tension headaches, migraine, cluster headaches, new daily persistent headaches, NDPH. Tension headaches. The most common type of headache is a tension headache. Tension headaches are due to tight muscles in your shoulders, neck, scalp, and jaw. They are often related to stress, depression or anxiety. Tension headaches are the most common type of headache among adults and teens. They cause mild to moderate pain and come and go over time. They usually have no other symptoms. Migraine. Migraine headaches are often described as pounding, throbbing pain. They can last from 4 hours to 3 days and usually happen 1 to 4 times a month. Along with the pain, people have other symptoms, such as sensitivity to light, noise, or smells, nausea or vomiting, loss of appetite, and upset stomach or belly pain. When a child has a migraine, they may look pale, feel dizzy, and have blurry vision, fever, and an upset stomach. Cluster headaches. These headaches are the most severe. You could have intense burning or piercing pain behind or around one eye. It can be throbbing or constant. The pain can be so bad that most people with cluster headaches can't sit still and will often pace during an attack. On the side of the pain, the eyelid droops, the eye reddens, pupil gets smaller, or the eye makes tears. The nostril on that side runs or stuffs up. Each headache attack lasts 15 minutes to 3 hours. They can wake you up from sleep. New daily persistent headaches, NDPH. These may start suddenly and can go on for 3 months or longer. Many people clearly remember the day their pain began. Secondary headaches. Secondary headaches are related to another medical condition, such as disease of blood vessels in the brain, head injury, high blood pressure, hypertension, infection, medication overuse, sinus congestion, trauma, tumor, etc. What causes headaches? Headache pain results from signals interacting among the brain, blood vessels, and surrounding nerves. During a headache, an unknown mechanism activates specific nerves that affect muscles and blood vessels. These nerves send pain signals to the brain. Common triggers of tension headaches include alcohol use, changes in eating or sleeping patterns, depression, emotional stress, excessive medication use, lighting, noise, weather changes, etc. Diagnosis. Once you get your headaches diagnosed correctly, you can start the right treatment plan for your symptoms. The first step is to talk to your doctor about your headaches. Your headache can be more accurately diagnosed by knowing when the headache started, how long you have had the headache, whether there is a single type of headache or multiple types of headaches. How often the headache occurs. What causes the headache, if known? For example, do certain situations, foods, or medications usually trigger the headache? If physical activity aggravates the headache pain, what events are associated with the headache? Who else in your family has headaches? What symptoms, if any, occur between headaches? Where the pain is located? What it feels like. How severe the headache pain is, using a scale from 1, mild, to 10, severe. If the headache appears suddenly without warning or with accompanying symptoms. What time of day the headache usually occurs. If there is an aura, changes in vision, blind spots, or bright lights, before the headache. How long the headache lasts. What foods, drinks, or events trigger your headaches? How much caffeine you drink each day? What your stress level are? What your sleep habits are like? If you have any work issues. Most people don't need special diagnostic tests. But sometimes, doctors suggest a CT scan or MRI to look for problems inside your brain that might cause your headaches. Skull X-rays won't help. An EEG, electroencephalogram, is also unnecessary unless you've passed out when you had a headache. Treatment. One of the most crucial aspects of treating headaches is figuring out your triggers. Once you know your triggers, your healthcare provider can tailor treatment to you. For example, you may get headaches when you're tense or worried. Counseling and stress management techniques can help you handle this trigger better. By lowering your stress level, you can avoid stress-induced headaches. Headaches can be treated with medication, stress management, and biofeedback. Not every headache requires medication. Stress management. Stress management teaches you ways to deal with stressful situations. Relaxation techniques are helpful in managing stress. You use deep breathing, muscle relaxation, mental images, and music to ease your tension. Biofeedback. Biofeedback teaches you to recognize when tension is building in your body. You learn how your body responds to stressful situations and ways to settle it down. During biofeedback, sensors are connected to your body. They monitor your involuntary physical responses to headaches, which include increases in breathing rate, pulse, heart rate, temperature, muscle tension, brain activity. Medications. Occasional tension headaches usually respond well to over-the-counter pain relievers. For frequent or severe headaches, your provider may recommend prescription headache medications. Triptans and other types of drugs can stop a migraine attack. You take them at the first signs of an oncoming headache. How can I prevent headaches? The key to preventing headaches is figuring out what triggers them. Once you determine your triggers, you can avoid or minimize them. For example, you may find that strong scents set you off. Avoiding perfumes and scented products can make a big difference in how many headaches you have. The same goes for other common triggers like troublesome foods, lack of sleep and poor posture.